Hi, so I'm Dr. Ellen, and so I specialize in treating some conditions of the gut in terms of how it relates to pelvic health. And one thing that women don't always know is how pregnancy and even the period postpartum can affect your small intestine, colon, and other organs in your abdominal area. And so, one change that does occur postpartum is you still have some of those hormones affecting your mobility of smooth muscle in your body. And so, typically, if you felt like things were a little bit more mobile during pregnancy, that can still linger as your hormones continue to change postpartum. How that affects your gut is that it actually can cause your gut to move a little bit slower because there's smooth muscle lining all of those organs that help propel and push things through. So you can almost think that those muscles are almost stunted and they're a little bit slowed down. So typically what can happen is sometimes people deal with constipation postpartum because things aren't moving through the GI tract as quickly. That can also cause more gas at times because whenever things aren't moving through us, they're kind of lingering. And that usually means that our body has more of an opportunity to produce gas versus if things are just moving out and through. Another component of that is, as we all know, the uterus expands a lot during pregnancy and it continues to reduce in size postpartum. But because of that expansion, our gut and other organs had to be pushed and moved out of the way. And sometimes those organs just need a little bit of help finding their way back to center again. And so just how you can have a tight muscle, you can actually have some tight fascia, which is connective tissue that surrounds the gut as well. That can be either causing gas pains as things move through it, or even some bloating and constipation as well.
And what does that have to do with the pelvic floor?
So if you think about the pelvic floor, we know that pregnancy really puts a lot of load through the pelvic floor, but other organs other than your uterus can do the same thing. So if your GI tract is really being used as a storage unit versus a transit out of the body, the pelvic floor can sustain a lot more pressure and load even in that postpartum time, especially if you're also dealing with constipation as well.
Can that contribute to other types of symptoms like pain or incontinence or?
Absolutely. So because of the way that the rectum, which is where all of the stool is stored before you have a bowel movement, is located behind the uterus and also behind the bladder, that if we're not emptying our bowels, a lot of patients actually report increase in some of their urinary incontinence symptoms as well because there's just a lot of pressure in the pelvis. And sometimes that's originating from the gut, sometimes it's originating from the rectal region if you're not eliminating stools very often. And so many times people are very quick to blame some of their issues postpartum on, I have a weak pelvic floor. And although that may be true, the pelvic floor may also be weak and sustaining extra load from the gastrointestinal system.
How can postnatal PT help with gut issues?
Well, just how PT helps with anything, we get it moving. And we also find its equilibrium. And typically, when we treat the gut, once we can get things moving better, your gut is part of a system in your body that is regulated by your autonomic nervous system, which means it should automatically be functioning, just how our heart beats. And so if we can get the right inputs there, get things moving, getting people on a bowel plan to help eliminate things, the stuff typically starts regulating itself after some treatment. It's different for everybody in terms of the timeline, but it can be super helpful postpartum and not always something or an area of your body you think about postpartum.
Cool. Thank you.
Mm-hmm.